Hi, I'm Dr. Donald Fry. I have the privilege of being Senior Vice Provost for Health Sciences here at Creighton University. For 15 years, I had the opportunity also to be the chair of the Department of Family Medicine in Creighton University's Family Medicine Department within our School of Medicine. During that time, I was able to interact with our residency program, our undergraduate program here at Creighton University, as well as a number of other activities within our department. Looking back on that, as chair of the Department of Family Medicine was one of the greatest times of my life. Why? Because of our faculty, because of the students that we taught, but most of all because of the quality of the residents that were at Creighton University's residency program. Our goal is to prepare the best residents that we possibly can. Not only is our department dedicated to that, but at Creighton University, our entire university is directed toward producing outstanding individuals and outstanding physicians. At Creighton University, we understand that family medicine is the bedrock of healthcare in this country. As we look to the future, family medicine is going to become even more important. We invite you to look at our program, to be a part of our program. And if this is what your future looks like, we invite you to participate with us.
I'm Lathan Nasser. I'm professor and chair of the Department of Family Medicine at Creighton University Medical Center. And I believe this is a very exciting time for our program. With our new clinical partners, Allegiant Creighton Health, we have now been able to expand our clinical activities, and in the future I believe we're going to be expanding the program a great deal more.
This is a really exciting time to be in family medicine right now because I think healthcare is changing, not just in the United States, but around the world. As medical director, one of the things that I do is try to impart my vision toward the residents. Just to give a quick example of this, for my patients, their lives don't take place in my exam room, so I don't think that their healthcare should take place solely in my exam room. I think that the new vision of medicine is to take care of patients in the totality of the patient's experience. Being a family practice doctor, one of the things that I do and train all the residents to do is take care of the patient as a person, as a whole person. That's a patient that has a job, has a family, has relationships, lives in a town, and all of that's important to their health care. All of that is taken into account when you see a family practice physician. What might be important to a patient, what might be affecting a patient. It can come from so many different aspects of their environment. So I think moving medicine forward, healthcare shouldn't be just an exam room experience. It should be an experience that does take place in the exam room, but includes the whole patient, their whole life, and their whole experience. So we have some outreach programs, our nurses outreach, and we try to meet with patients in more places than just here and take care of them in their life, where their life happens.
When caring for the refugee population, we need to have language services with interpretation. So we have 4 interpreters.
Just tell them to tell me if any of this hurts.
And also Sericom lines that allow us to educate and translate information to the patient. When I'm working with a diverse population, I'm working with normally 5 different organizations. I'm working with the mental health organization, home health, our social work, and our dietitian and endocrine. There are many rewards and some challenges when working in the residency clinic. The rewards that I have when working in the residency clinic is helping groom the doctors of the future and my part in that.
Within my class itself, we have a very close-knit group of people who hang out regularly. We check up on each other constantly and see how we're doing and how we're coping with things and how we're adjusting. I feel like the relationships I've made since I've been here have just been positive to the point where I feel like this is a second home to me. So I'm going to listen to your heart, okay? My future goals include successfully completing the 3-year residency program here at Creighton, and then going on to pursue a practice in family medicine. I would prefer to stay in the Midwest region and hopefully have a fulfilling private practice. Also, I'm interested in obstetric care, and I would like to see obstetric patients in part of my practice, and I'm positive that I'll be able to continue that based on the experience I've had at Creighton.
So I believe with the new collaboration with our new clinical partners at Legion Creighton Clinic provides our residency program with an opportunity not only to treat patients in a small geographical area, but to provide care to patients throughout the state. And this opens up new training opportunities, new resources, and new ways of carrying out training. And so I think this is a very exciting time for us.
What kind of dressing would you like to use for this toenail?
I'm a family practice working at Legion Creighton Clinic, Twin Creek, Bellevue, and also a faculty member at the Family Medicine Residency program with Creighton University and specialize in women's health. I was living in North Carolina before I moved to Nebraska. And within 3 months of starting my residency, I was sure this is the place I'm gonna stay and raise my kids. Omaha lives right in the center of United States of America with 1 million population, college town with 2 medical universities, excellent private and public schools, several museums, a world-class zoo. Omaha provides a stimulating environment for young families and young professionals. As a resident, I started off with a robust team of fellow interns, senior residents, outstanding faculty, great academic environment, where I not just worked with family practice faculty, but also with faculty from other departments like pediatrics, obstetrics, internal medicine, general surgery, amongst many others. It helped me shape up to become a well-rounded family physician.
I'm very impressed by the quality of people that we work with at the university. I'm very impressed by our faculty, and I'm very impressed by our specialty colleagues and their commitment to our education. And I think that we have a very exciting program.
Our emphasis at Creighton is really in helping prepare our graduates to be the best possible family physicians for the future. We're looking towards a healthcare redesign where primary care is increasingly more important. Patients are looking for a long-term relationship with a physician who gets to know them and gets to know their needs. Creighton University is a fantastic place to train to become a family physician. Our Jesuit values, our Ignatian values, really encourages us to have a transformative experience. We're transforming the lives of our patients, but we're also ourselves having a transformative experience through caring for others, through our educational experience, through our curriculum. It's time for innovation. It's time to really become better equipped to provide a great base of primary care for our future and for the health of our country. Thank you so much for taking the time to learn about Creighton Family Medicine. It's a great place to learn, it's a great place to train, and we hope you enjoy your time while you're visiting with us.